Hello everyone, I am Eric, the AI assistant, who will be hosting this video presentation for Collaborate Session 4.
Today, we're delving into a topic that often creates confusion: the distinctions between psychologists, counselors, and therapists. While these terms are often used interchangeably in casual conversation, they represent different professional roles with unique qualifications, approaches, and areas of focus. By the end of this lecture, you'll have a clear understanding of what sets these professionals apart and how they contribute to mental health care. We'll discuss their education, licensure, specialties, and the types of clients they typically serve. Let's start with psychologists. When you think of a psychologist, you might picture someone conducting research, administering tests, or providing therapy. Psychologists are trained professionals who study human behavior and mental processes in depth. Education and licensure. 1. Degrees. Psychologists typically hold a doctoral degree such as a PhD, Doctor of Philosophy, or PsyD, Doctor of Psychology. A PhD focuses on research and academia. A PsyD is more practice-oriented, emphasizing clinical work. 2. Licensure. After earning their degree, psychologists must complete supervised clinical training and pass a licensing exam to practice independently. Key roles. 1. Clinical psychologists provide therapy to individuals, families, or groups, diagnose and treat mental health disorders such as depression, anxiety, or PTSD. Use evidence-based approaches like cognitive behavioral therapy, CBT. 2. Research psychologists conduct studies to advance our understanding of behavior and mental health, often work in academic or institutional settings. Unique abilities. Psychologists are trained to administer and interpret psychological tests such as IQ tests, personality assessments, and neuropsychological evaluations. They often collaborate with medical professionals to develop comprehensive treatment plans. Next up, counselors.
The guides for personal growth.
Counselors focus on helping people manage specific challenges, develop coping strategies, and improve their overall well-being. They are more likely to deal with situational issues rather than severe mental health disorders. Education and licensure. 1. Degrees. Counselors typically have a master's degree in counseling, psychology, or a related field. 2. Licensure. Counselors must complete a supervised internship and pass a licensure exam. Common licenses include Licensed Professional Counselor, LPC, Licensed Clinical Professional Counselor, LCPC. Key roles. 1. Mental health counselors provide therapy for individuals dealing with stress, grief, or relational challenges. Often specialize in areas like family counseling, substance abuse, or career guidance. 2. School counselors help students with academic, career, and personal development. Act as a bridge between students, parents, and educators. Unique abilities. Counselors emphasize practical problem-solving and goal-setting. They often focus on short-term therapy and specific challenges rather than deep-seated psychological issues. Therapists.
The umbrella term.
The term therapist is a broad category that can encompass both psychologists and counselors, as well as other professionals like marriage and family therapists or social workers. Types of therapists. 1. Marriage and family therapists, MFTs. Specialize in relationships and family dynamics. Hold a master's degree and a specific license for marriage and family therapy. 2. Licensed clinical social workers, LCSWs. Address broader issues like poverty, housing, or systemic barriers, in addition to mental health. Often have a master's degree in social work, MSW. B. Key roles. Therapists provide therapeutic interventions to help clients improve their emotional, relational, and psychological health. They may use a variety of techniques, including talk therapy, play therapy, or creative approaches like art and music therapy.
E. Unique abilities. Therapists are highly flexible and often integrate approaches from multiple disciplines to meet the client's unique needs.
Here is a graph which shows all three together in a side-by-side comparison. Now for the overlapping responsibilities. While these roles differ, there are significant overlaps. For instance,
all three professions can provide talk therapy. They all aim to improve mental health, though their approaches may vary. Collaboration between these professionals is common, especially in team-based settings like hospitals or schools.
Real-life scenarios. Let's bring these distinctions to life with some examples. 1. Scenario 1. A student struggling academically. A. School counselor. Might help identify underlying stressors and suggest study strategies. If the student shows signs of a learning disorder, a psychologist might conduct an assessment. If family issues are involved, a family therapist might work with the entire family. 2. Scenario 2. A client with severe anxiety. A bar counselor could help the client develop coping mechanisms for immediate stress. A youth psychologist might provide a deeper exploration of the anxiety's roots and offer evidence-based treatment. A mood therapist might combine approaches such as mindfulness exercises or cognitive restructuring to address the anxiety. So how do you choose the right professional? If you or someone you know is considering mental health support, how do you choose the right professional? 1. Severity of the issue. Severe mental health disorders may require a psychologist or psychiatrist. Situational challenges may be better suited for a counselor. 2. Specialized needs. Couples therapy. Look for a marriage and family therapist, MFT. Career guidance. A counselor with expertise in career development might be ideal.
3. Assessment needs. If psychological testing is required, a psychologist is the right choice.
Understanding the differences between psychologists, counselors, and therapists helps us appreciate the diversity of mental health care professionals and their unique contributions. Whether you need in-depth psychological assessment, guidance through a tough life challenge, or someone to help you rebuild relationships, there's a professional suited to your needs.
Mental health care is a collaborative field, and knowing these distinctions empowers you to seek the right help when needed. Are there any questions or examples you'd like to explore further?
Thank you for joining us today. Please come back next week. Have a great day.